261. Today, 261. Tomorrow, another 261. Yesterday, the day after, 261 citizens of the Republic of Kazakhstan will become diabetics. That means a huge number every year. People that cannot control the glucose level. 2% of the Republic of Kazakhstan GDP is required to pay for the complications associated with this disease. So all the economic activity of the Republic of Kazakhstan of 1 week, every year, is dedicated to pay for the consequences of this disease. That affects most 1,800,000 people here that suffer the consequences of this disease, their families, the healthcare system, and the society overall. I come from Zaragoza, a city in northeastern part of Spain, provincial city. This is the School of Medicine of the University of Zaragoza, where I trained as a doctor. The last lecture of the first year course of anatomy, which is a subject that all medical students in the world love, the professor of anatomy, in his last lecture, told us university education in Spain is basically free, it's paid for citizen taxes. This is a public university. You are going to receive a wonderful education, but you have a social responsibility. And this social responsibility is not just for your patients. You have an Hippocratic oath. You have a moral responsibility for the health and well-being of the people, because you are receiving this education and you have to give it back to the people. So in the hospital behind the School of Medicine, there are surgeons who operate patients every week, 2, 3, 5 patients. That makes a lot of patients in a year, in a professional life. There are cardiologists seeing patients in inpatients, outpatients. There are general practitioners working in primary care centers, attending 2,000 patients. And then my reflection was, how can I have this lasting impact? And then I thought, let's try to improve what we know about health and disease, being a clinician scientist. So I can help surgeons providing evidence on how to treat diseases. I can help cardiologists and endocrinologists to help diagnose and treat diseases. I can help general practitioners. So the exponential capacity of my activity will increase significantly, not just through my own patients, but through the patients that my colleagues can see and can treat better if we improve our knowledge regarding health and disease. Diabetes. Diabetes is a disease in which you basically cannot control your glucose level. You have sugar circulating in your blood, and sugar is essential. Glucose is essential as an energy for our cells and for our organisms. But if you cannot control your glucose level, then you start having problems, serious problems, that will affect your arteries and capillaries because glucose is toxic. And beyond certain levels, affects arteries and capillaries. And people with diabetes die from cerebrovascular disorders, myocardial infarctions, become blind because the retinal arteries are affected, have significant renal problems. It's the principal cause of dialysis and renal transplantation, and affects severely peripheral arteries and capillaries and represents significant burden for people in terms of amputation. So life of diabetics, the long term could be catastrophic and seriously. This is very interesting because we know everything about diabetes. However, diabetes still represents a tremendous burden for people, for the families, for healthcare systems, and for the society at large. As with many other diseases, diabetes is a combination of factors in which genetics, in which lifestyles, in which environmental, and of course, the clinical treatment of these patients affect how this disease progresses and how this disease may be stopped or controlled. This is data that we have from the work we are doing here in Astana and from Kazakh patients. And basically, what we are seeing in our work is that diabetes is a heterogeneous group of conditions which share exclusively one characteristic, which is the incapacity to control the sugar we have in our blood. But there are very different types. You may have heard type 1, type 2 diabetes. In Astana, there are 5. There are 5 types of diabetes. We want now to continue this investigation describing individual risks and vulnerabilities in a population in order to define segments of patients that have common characteristics and how they develop the disease, and therefore that have different ways in which this disease has to be treated. You may have heard for sure about personalized medicine. This is personalized medicine. Personalized medicine aims to identify individual characteristics, clinical, lifestyle, genetic, that influence how you, in this case, can control or not control sugar levels. And let me tell you, we have more unknowns than Azamat in his formulas. The idea for us is to develop algorithms that help to classify patients based on their individual risk, based on their individual characteristics, so we can develop target interventions to a specific subgroup of patients. Brief comment of a life of scientist. A life of scientist is exciting, but also with certain challenges. We need to get money for our research. We have to publish. We have to work long hours. And our professional career, especially for young professionals, it's challenging. And on top of that, we have to understand where we are, and we have to be able to translate into actionable actions the results of our science. So Kazakhstan population in the last 50, 80 years has transformed significantly from rural people to an urban way of life with all the specific characteristics that they represent, but also has ethnic peculiarities that make it different and common at the same time to other groups, Caucasian or Asians. So it's a challenge to investigate research here. I want to also take this opportunity to thank those who are supporting me. The Republic of Kazakhstan, through grants from the Ministry of Education and Science, of course, my university, but overall, my lasting impact will be here. With Binura, with Alim Shan, with Aida, with Kimbat, who are my PhD students, and the lasting impact will be when they can become scientists and continue and improve what we know about this disease and many other diseases. Keb Rahmet.